Audio recording for this meeting has begun.
All right, great. So all lines, we're requesting that everyone please mute all of your lines to limit any sort of background noise or chit-chatter so that everyone can hear the conversation. So please, on Adobe Connect, make sure that your lines are muted. There will be an opportunity at the end to unmute specific lines for questions. But if you have questions or need technical assistance during this call, please utilize the chat function in the bottom right corner of your screen. And you can also send a private message to my colleague, Leandra Lacey, who's listed under the Host tab to the right of your screen. All questions will be addressed at the end, but we'll be sure in the meantime to keep a queue, so feel free to ask questions as they come up. Now we're just going to get into a little bit of background about the webinar itself and why we decided to host this today. So we've heard from multiple jurisdictions about concerns around spending down STD federal funding, including the fifth-year AAPPS funding and supplemental funding. And we were hoping that by hearing from a few of your colleagues who come up with some creative ways to spend down extra funding in the past, it will help you identify interesting ways for spending down your own funding. Ensuring the spend down of your programs is particularly important politically and also for ensuring new funding for the field in the future. As we saw with Ryan White funding recently, money can be transferred within HHS to other project areas, including the Office of Refugee Resettlement. For this year, because it's the fifth year of AAPPS, most likely any unspent money will go directly back to the Treasury. If money is sent back, this can make it particularly more difficult for us here at NCSD as we argue for the reasoning for why there should be more money for the STD field. We understand what your particular challenges are and are very aware of that, but a lot of the outside field is not aware of that, and it's hard to be able to communicate that politically for increased funding. So we are aware of what the challenges are, but it's visually hard to explain that elsewhere. So just a bit of an overview of the agenda. We're very pleased to have Beth Butler from Pennsylvania with us, Chaquetta Johnson from Louisiana, and Brittany Wardle from Wyoming. And they're going to present a bit on how they've spent down money in the past, and we're also going to have a brief overview of the funding landscape from Beth at the beginning. So without further ado, for the main part of the presentation, I'm going to go ahead and turn it over to Beth.
Good afternoon, everyone. When this topic came up, I thought that we should also kind of go over some of the challenges in dealing with federal funding. And I actually put this forth to my budget office, too, for them to take a look at this part of my presentation. And the first thing I wanted to talk about, there we go. Okay, so federal funding key points to remember. Each grant cycle is a 5-year cycle. Each year of the cycle requires a 424A to be submitted. And on that 424A, if you look at the bottom, you're documenting all 5 years of funding. However, there's a caveat that each funding year could rise or fall depending on, the funding at CDC and the center's ability to give out funds. Continuing resolutions at the federal level make it really, really difficult for them to give a single award. So in other words, every year for the last, I'd say 4 or 5 years, we've been receiving 2 or 3 awards. So you'll receive one in December letting you know what the entire award may be, and you'll receive a portion of it. Then you'll receive a second award with additional funds, and then a third award, which will have your final amount to bring you to your total award. So if a project area leaves unspent or unobligated funds, those will continue to add as your grant cycle moves forward. CDC cannot take those funds back as they are allocated to the state specifically or project area specifically. The only way the CDC can take those funds back is by determining an offset with unspent or unobligated funds. Therefore, if you leave unobligated dollars there and they re-award those to your project area, you're receiving less new money, and those funds remain at CDC. So let me give you an example. If I had an award of $500,000 in my first year, and because of staffing issues or whatever it would be, I didn't spend $50,000. That $50,000 sits in my Pennsylvania funds until the end of the 5-year cycle. In year 2, I should be able to request unobligated of $50,000 to make my entire award for the second year to be $550,000. If CDC determines that they need to do an unobligated offset, I would only receive $500,000, and they would give me $450,000 of new dollars and $50,000 of unobligated. So in essence, CDC has now only given Pennsylvania $450,000 new dollars, and $50,000 remains at CDC. So that's basically one of the only ways that they're able to do that unless there's a reduction in a subsequent year. So if you have questions about that, I can kind of answer that later. So I've been told, and many, many times by GMO staff, that each division at CDC seems to be able to determine if unobligated can be requested to be added to a subsequent year, how that unobligated can be spent, and the amount of the unobligated that will be approved, or the percentage that will be approved. However, the only way to really protect the loss of your unobligated money is to spend all your money allotted each year as best as possible. You don't want to have to try to request it back. So many of us are in the same situation where we don't spend all of our dollars and leave it unobligated. We have hiring freezes. We could have retirements, and you might be hiring somebody at a lower rate. Your jurisdiction could restrict you on spending itself. And you may have contractors that you have contracts with the same types of issues. On top of that, with indirect charges and so forth, that again can affect that unobligated. However, spending all allocated funds is really important for future funding cycles, as was already stated at the beginning of the call. So I wanted to give sorry about that. I thought I went through too fast. Okay, so the landscape of Pennsylvania. Pennsylvania is a medium morbidity project area. And in AAPPS for us, we lapsed over $100,000 in year 1. We had some issues with DIS staffing. We had contractors that lapsed some funds, and we had indirect funds that were unspent. In year 2 and beyond, when we were denied and obligated after our first year, we began to move funds around so that we could spend them more readily. And we lapsed in year 2 only $7.45. And in the last year, we only lapsed $500. We were also the recipient of a supplemental evaluation grant. We used that funding for a contractor who's an evaluator, and we've been able to spend just about every dollar on that. However, in year 3, when they gave us our first award, those funds were completely absent. We had to fight to get those funds added on the second award that was given. Year 4, those funds were cut without warning. So we were cut this past year for that. Challenges for spending. So systems and processes for us that create challenges are staffing changes and restrictions from CDC. It could be, like I said, we have a retirement and we hire somebody at a lesser rate. That leaves funds sitting. It could be that we lost a staff member and it takes months for civil service to allow us to hire someone, because we have a civil service system here in Pennsylvania, and they review just about everything through. It could be a governor's office restriction on employment as well. Even though it's the federal funds, They do sometimes put hiring freezes upon us every summer when they're working on the budget. So, so when they're working on those approvals, that can happen as well. So things that required us to look at challenging ways: unspent indirect funds, the inability to use funds to purchase items, which is the CDC restriction, and CDC's continual changes in unobligated language and allocations. So for us, it's requesting the unobligated and being denied. I've argued the point and I failed miserably. However, I know that my tuberculosis program that I oversee, they ask for unobligated, they get the full amount every time, as well as some of the HIV programs as well. They request and they do get a substantial portion of their unobligated. And there's really no restriction on how they spend those dollars. So receiving the money out of AAPPS created some challenges for some. We needed to think of a one-time project. We could not use 5 months of funds for the future. So, hiring somebody was difficult, contracting with someone was difficult. So what we did in Pennsylvania to do that is that we worked with our Bureau of Information Technology to do a fix for our provider index for our PA-NED system. So we're going to be supporting a master provider data initiative to correct provider data entry in our PA-NED system via ELR. We have multiple providers that have names that are backwards, forwards, and different ways. So we're now going to try to make one master list so that when a provider puts in and they're John Doe instead of Doe John, we can get it switched via this master provider data system. And we're going to be working with our IT program. They're going to learn how to do that and do the governance of it, and then they're going to maintain it to make sure that we have the right provider with the right reporting. So the way we monitor our money, we've learned a lot after the unobligated issue in our first year. And we started monitoring monthly with grants management reports that we are getting from our budget office. So we're working with our budget office and ourselves now, monitoring funds every month, making sure that if we need to move something from one category to another, we are doing so. And it's enabled us to spend our money more efficiently because we've done it during the year. And you can move up to 25% without asking CDC for approval, as long as it's within something that you already have in your budget. And that's all I have. Thank you.
Great, and thank you so much, Beth. So we, if there are questions that you have, like I mentioned, we're going to take time at the end after all 3 presenters go, but in the meantime, please feel free to start queuing your questions in the chat box if you have one specific about the presentation. But right now I'm going to turn it over to Chaquetta Johnson with Louisiana.
Hello, good afternoon, everyone. I am Chaquetta Johnson. I'm Deputy Director for Operations with the Louisiana STD HIV program. And thank you to NCSC for inviting us to share some of our creative ways to spend down our award. Just taking a look at our STD morbidity here in Louisiana, as everyone knows, we have consistently ranked very high when it comes to STDs. And that was the case in 2016. Of course, the rankings are not available yet for 2017, but as you can see, we still had increases in our congenital syphilis, GC, chlamydia, with a slight decrease noted in our HIV numbers and also in our PNS syphilis, but we still did see an increase in early syphilis. So overall, we had increases across the board except with our HIV and PNS syphilis. With our anticipated balance, or what we anticipate to have left over in year 5, is around $250,000 to $300,000. And that's mostly resulting from our congenital syphilis supplemental grant that we received last year. And we did apply for the additional AAPPS supplemental funds, which we are waiting to hear with regard to our notice of award or approval of those funds. And when it comes to challenges here in Louisiana, we do have a very cumbersome procurement process. meaning that we do have to go through a bidding process because, we are affiliated or under the umbrella of the Office of Public Health. So even simple things like buying furniture or equipment can sometimes be a very laborious process. Also, with the recruitment and hiring process, we do have a civil service system in place for state employees. So that can take a little bit longer when it comes to recruiting or hiring new people. And there's also a very lengthy contract process. And also, we're limited on the type of entities we can contract with due to ethics laws here in Louisiana. So that can really slow down our process in being able to spend dollars. And we've seen that as a challenge for several years. Unanticipated resources or funding coming from other sources, such as with Medicaid. Here in the state, we had our targeted evaluation project with extra genital testing. And we worked very closely with our reproductive health team to get Medicaid to cover extra genital testing. And that process took several months, but once Medicaid did begin to cover that testing, we no longer had to support that activity with our AAPPS funds as we had budgeted. So we did have some additional Medicaid funding that reduced the amount we had to expend. So that left a little bit of money left on the table. And then also, as far as budgeted travel, we anticipated training for our DIS across the state that were interrupted due to flooding and other natural disasters. So we ended up having to cancel those meetings as well as not using the funds for planners and travel. And how we have worked around some of those challenges, we established personnel subcontracts. We have two major personnel contracts, one with LSU and another with a private community-based organization. And that's allowed us to be a little bit more flexible in our hiring process. Here in the STD HIV program, we have very few state employees. The majority of our staff are contract employees. And but another pro to that is that we have a lot of latitude in being able to specifically seek the types of individuals who will meet the needs of our grant requirements. So we have a little bit more latitude in our hiring processes, as well as the qualifications we look for in the individuals we are able to hire. So that's been a good thing in many ways. Also, consider subcontracts for short-term projects. If you have evaluation projects or data analysis projects that need to happen in a relatively short period of time, that would also be an opportunity to use some of those funds. Here in central office, our central office staff doesn't get to travel under regular circumstances to do quality assurance and direct training and offer technical assistance. In the past, we've been very restricted in our travel requirements to meet those travel requirements here in the state. So with the additional funds that we had with AAPPS, we were able to cover more travel for activities like those, which we haven't been able to do in the past. So we were able to shift some of that money that was left over from the trainings that were canceled to be able to do some technical assistance and trainings like for our DIS staff. We were also looking at reallocating some of our funds for syphilis test kits and limited amounts of testing supplies. And that was for, like for syphilis testing, cotton balls, alcohol prep, things that don't necessarily expire, but can be helpful to our health department clinics so they don't have to cover those expenses on the local level. We've been able to support some of those activities. And one thing that was new was with working with our Bureau of Family Health with their Title X budgeting. They did not have enough funds to cover female condoms to be available in the clinic. And we know that sometimes, buying condoms can be a tricky issue. But we, in working with them, we wanted to cover enough female condoms that could be used as training tools for the staff so they could offer it as a viable method of contraception. But the patient could then receive a prescription for the actual, for continuing the method if they so chose to do that. But actually buying just enough to be a training tool versus buying condoms for distribution. And then with the purchase of software and software licenses, and Beth kind of touched on this in her conversation, but strengthening your IT and your data and surveillance team and allowing them to purchase additional software can really support their work and go a long way with making your surveillance reports, your dissemination more robust. So that's a definite way to invest those funds usefully. And what we've really been trying to focus on here in the state is our patient and provider education campaign. And in 2016, we formally launched our Louisiana Health Hub website. And there was a lot of attention for PrEP and HIV prevention, but not a lot done around STD prevention. And in 2017, we really pushed to increase our STD presence on the website, but we needed a staff person to really devote their time to, promoting that information or creating that information around STD. So as a part of our congenital syphilis grant, we did have a health promotion coordinator who was focused on not just congenital syphilis prevention but also our STD prevention messaging. And so we were looking to increase those activities as well as the materials that we developed for those campaigns and looking at spending money on things that we haven't been able to do in the past as far as billboards and bus ads and Facebook, social media presences for STD prevention. And so those are some ways that we were able to request funds, and we did get approval to spend money in that way. But it's something that I think has been very positive, especially it's been well received by the public as well as health department staff. And then next, increasing the coding of staff time to STD. We, in the past, a lot of our HIV prevention staff that may not have worked on STD activities have now been pulled into a lot of our provider education and outreach events. So they've been able to code much more of their time to STD activities than they have in the past. And that is another way we've been able to use some of those funds. As far as our fiscal management, we have a very close relationship with our program financial operations unit manager. And he does have visibility on not just our STD budget, but also our prevention budget and our Ryan White resources as well. So he is brought in anytime we have any new major budget adjustments. And also we meet with him quarterly to review the AAPPS budget to make sure, to kind of assess where we are and how much we need to spend to really stay on track and be fiscally responsible. Okay, and that's it for me.
Great, thanks so much, Chaquetta. I'm now going to turn it over to Wyoming with a presentation by Brittany Wardle.
Hi, everyone. My name is Brittany Wardle. I'm the Communicable Disease Prevention Program Manager for the Department of Health in Wyoming, and I cover STDs, HIV, viral hepatitis, and tuberculosis. So I'm just going to show you here the landscape of Wyoming. You'll see that we are a low morbidity state, so I appreciate the opportunity from NCSD to present the small state perspective. Our AAPPS awards have ranged from about $200,000 to $260,000. Our Unobligated balance tends to be around 5%. This year, we anticipate it to be less than 3%, and that's about $6,000 for us. So we usually, of course, given that we have a small amount of money, spend quite a bit of it. We do have additional federal funding that provides money for us to offer STD treatments in our public health nursing clinics, so it pays for medication, and we do not have any state funding for STD prevention. So similar to what Beth and Chaquetta talked about, our challenges are very similar. Staff vacancies tend to hit us especially hard because staffing is a good portion of our small budget. And then travel restrictions, where we have had instances of trying to send multiple people to a conference like NCSD or other conferences, and are often questioned or restricted in the number of staff we're able to send. Our third and probably one of our biggest challenges is at the state level. So we have to have a contract in place, and similar to other states, it's no easy process. Our contracts typically take 3 to 6 months. So it's very time and resource intensive, and often gives us a short window in which we can actually execute those services and spend those funds. So we have to have that for anything over $1,500. So we often toe the line of $1,499 on many of our contracts for that reason. So that is definitely challenging for us in trying to bring in trainings or trying to spend money to ensure people are aware of the services that are available. So I want to highlight some partnerships that we rely heavily on to spend our funding in Wyoming. Much of what we do is at the local level, and they have far less restrictions than we do in terms of spending the money. So there are quite a few listed here, but the ones that I'll be talking about most heavily are our internal partners, public health nursing offices. We have one located in every county. And then also our external partners, our family planning or Title X clinics, federally qualified health centers, and then Wyoming Equality, our corrections partners, and also our universities. So how we have spent our money and some of how we plan to spend our supplemental funding this year, these are just several things that we've implemented. For testing, we still fund quite a bit of our local sites for the testing that they do, and we do just reimburse the laboratory fees associated with chlamydia and gonorrhea. For us in Wyoming, syphilis labs are run for free through our public health laboratory, and that's just due to a statute, which I find very helpful. So we only have to pay for chlamydia and gonorrhea tests. We do offer extragenital testing at all of our test sites, so that is available. And oftentimes we'll fund routine testing that people come into the clinic for, and we'll also fund testing events. So we have local public health nursing offices that will work with various community-based organizations, places like jails or homeless shelters, to offer special testing events, and so we'll also cover testing costs associated with those events as well. Another way we get out our funding is through what we call funding opportunities. So each year we create a standing request for applications that's available for any partner, whether it's our public health nursing offices, our Title X partners, federally qualified health centers, colleges. So anyone can apply for these funds. And it's to support activities that occur at the local level and are related in some way to STD prevention. So we have done that by setting up a Google form. That form is active all year and monitored by staff. So we review applications as they come in and then fund a variety of activities. Some things we have funded are testing events, like I mentioned, for universities or colleges. We've done Pride events, testing at Pride events, or things like that. We also fund, similar to Louisiana, advertising. So a lot of our local partners don't have money for advertising, of course. So we're able to support their advertising of STD testing and prevention services that they offer locally. They've done it through bus ads in some places. Some agencies have placed cinema ads in movie theaters. So it just depends on what they're doing at the local level. But we've also had some agencies use it for Facebook ads. And so that is here also a very popular way for our local partners to access our funds and increase awareness of their services. We've also supported travel for our local partners to national STD conferences. We send public health nurses to NCSD and the CDC STD Prevention Conference and some other sexual health conferences that come up. So we offer them the chance to get continuing education and just have an opportunity to see what the relevant topics are nationally. And that's been very well received. For the supplemental funding, we plan to offer a larger amount of money, so we're going to fund 5 different sites for up to $5,000. And again, we've crafted a very specific request for applications and also are doing that through a Google form. Safer sex kits, that's something that we've done a lot more with corrections. We did a statewide jail survey on communicable disease testing and treatment to establish a baseline of what our correctional facilities are doing locally. And many of them indicated interest in safer sex kits for distributing to inmates who are being released. So we have probably 5 of our 23 counties that we're working with currently to set up tailored safer sex kits. Those might include things like harm reduction materials, condoms, dental dams, lube, and that's been very well received by our local jail partners. And the 4th item here I have is condom distribution. So here in Wyoming, we do those through clinics, of course, and then we also have physical dispensers. We do purchase ours through Total Access Group, not that I'm advocating for them, but our staff do provide local public health nurses with a condom dispenser packet. That way they're able to take that packet to local places of business, places like bars, substance abuse treatment facilities, liquor stores, any place that will agree to host a condom dispenser. They take that packet and then we allow people to order those from us, and we send out dispensers that can be hung in bathrooms or on clinic walls, wherever they want them, so they can distribute those as well. And then we also fund condom mailers, and those are, again, accessible through a Google form for the general public, and they can order those, and we have directed funding for those in advertising. So our adolescents are aware that condoms are available through the mail as well. As far as monitoring our money as a small state, I am directly responsible for monitoring that budget, and I do receive assistance from a fiscal manager, so we're in close contact a couple times a month and go over expenditures for multiple CDC awards to see where we're at and ensure that we're spending on track. And I do want to note that for our funding opportunities and any time we're providing funds to our local sites, that's on a reimbursement basis, so we can ensure that those funds are being spent. And that was all I had. Thank you.
Great, thanks so much. So we're going to give everyone just a couple of minutes to either type your questions into the chat box or to unmute yourself to be able to ask any questions that you may have for our presenters. In the meantime, while we're doing that, as a question to all of the presenters, do you have plans over the next 4 to 5 months as the grant comes to an end? Is how you monitor your funds, do you think that that will change at all as the grant winds down?
This is Beth, and it's not going to be changing. We're pretty much on target with spending just about every dime again this year. I've been working with our budget office to assure that.
Great.
Yeah, and this is Chaquetta. We're really working hard to spend hours down by the end of the calendar year. We actually have a budget meeting tomorrow. So no, we anticipate trying to spend down all of our funds.
This is Brittany. I would say the same thing. I don't think we have any concerns about spending down our funds for the year.
All right, we're going to open the line briefly to see if there's any questions from the participants. Another question from me, Beth, is you mentioned, Beth and Chaquetta both mentioned your IT work that you're doing and working with your Office of Information and Technology as well. To get some of that, those tools actually implemented and purchased, did you have to go through a contract process for that, or how long did it kind of take to get that process started?
Well, again, like Brittany said, one of the issues for us, too, is contracting. Contracting in Pennsylvania, to get a contract actually in place on an RFP and so forth and taking that all the way through takes 6 to 12 months for us. So we've got to anticipate almost 12 months ahead of time because it has to go out on an RFP and on a bid. Anything over, for Pennsylvania, it's over $10,000. However, anything under $10,000, we can contract with just about anybody that would be on our general contract. So we're working with our IT folks. Actually, we're getting them training so that they can continue working on this for all projects, basically. They're just training on Pennsylvania's issues.
And now this is Chaquetta. We mainly try to concentrate on using contracts that were already in place that wouldn't require going through a whole new process. So that way it was just a matter of needing the resources, like buying additional SPSS or SaaS licenses or upgrading software and equipment that we already have. So we really try to focus on things that were already in place and just adding the funding.
Thank you both. Brittany, for your particular presentation, you talked about something that we found really interesting here, which was the standing request for applications from local partners. We're interested in kind of, I know that you touched a bit on this, but how long did it take to really set that up, and what was kind of the process that you went through for getting that standing?
I think for us, we did identify, of course, in Wyoming, sometimes the local health department is our only provider, or should I say competent provider for sexual health services in many of our counties. So we knew that there was a need to get this money out locally, but we also knew we needed to identify a way that would allow us to do that in a way that wasn't prescriptive and allowed flexibility on the local level. And so we did used to have, we made a fillable PDF application. So that was what we did previously, and that worked fine. So what we typically ask for is information about the organization itself. We ask for the type of event or type of outreach they're planning, and then we also ensure that we have the ability to capture an evaluation, so it's not just money going out the door and we don't know what's been done with it. So we usually ask for a category of the activity. We ask them to name the priority population, and then we also ask for a budget and then how that project will be evaluated. And so once we get that information in, it comes in through the Google form now, and we have 3 people that review it, and it's a very short form. We have people review it, and occasionally there's some back and forth if we have questions or need for clarification, but we've really had great feedback from the locals since we've implemented that Google form, and I'd certainly be happy to share the link if that would be helpful.
Yeah, I think that would be really interesting and helpful for us here, and we can share that as well with the people who are on the presentation and our members.
Sure, and I will just mention for our supplemental award, we do have to prioritize given that it's less money than we currently offer, so we have developed specific criteria for scoring them. For our standing applications, we usually don't have so many that we can't fund all of them, so it's not a problem. But for the supplemental, we have established specific criteria for funding those requests.
Great, thank you. I'm going to pause again for questions from those on the phone to see if there's any additional questions that people have.
And one thing I would like to add to, I did mention training as being a way that you can use spend down funds as well. And that can also go for professional development type trainings. And I say that because, for instance, with our Ryan White team, we did some motivational interviewing trainings that went over very well with some of our linkage to care staff. And we wanted to offer that to our DIS staff as well. So we did use some of our funding to do some motivational interviewing as well as emotional intelligence training for our DIS, which all of them found very useful. So those would be some opportunities as well, those types of training opportunities that, funds could be used for.
Great. And I also wanted to ask, besides just questions for those on the line, if there's any particular challenges that you feel you'd like to bring forward that, could be brainstormed with, or just challenges you feel the need to discuss, feel free to address those too, or creative ways that other people have also thought of spending down their money through their programs that would be useful for others to also hear about. We welcome those as well. All right. Well, sounds like most people have gotten a lot of information out of these presentations. If there are no questions, I am going to leave the contact information for the three presenters and myself for all of you in case there are concerns or questions that you continue to have that you would like to bring to our attention, or further questions that you didn't feel comfortable asking on the phone that you'd like to follow up with either Chaquetta, Beth, or Brittany. So I'll leave that there, and Leandra also just sent in the chat box a SurveyMonkey link if you can be sure to take that and evaluate this, so that we can think through how to improve these webinars moving forward as we continue to think about webinars for spend down. And also for the presentation that was recorded, we will be sending it out to all of those who are registered within the week. But without that, I want to thank Chaquetta, Beth, and Brittany. Thank you guys so much.
Thank you.
All right, thank you.
Bye, everyone.